Okay. StreamYard is giving me all kinds of messages that they're fixing to lose my Facebook. So I have to update that. Not really even sure what that means, but okay. Going to talk to you today on this Friday Lunch and Learn about congestive heart failure. Now, you might think, oh my goodness, that sounds really disastrous. And it can be. I will tell you there is no medical treatment for that. They will give you medication to help your heart work better, but they're not going to give you something to heal your heart. But I'm going to talk to you about 7 herbs and supplements that have been proven, scientifically proven, to help your heart. We have a formula here in the clinic that we absolutely know without a shadow of a doubt is good for congestive heart failure. We've had people that have come in with a diagnosis from their medical doctor that they have congestive heart failure, and they have taken this formula for a year. And when they go back to their doctor at the end of the year, they no longer have congestive heart failure. And the doctors don't know what's gone on. They don't know what's happened, but we know that God has given us the good stuff so that we're able to work with that. So if you follow us on Facebook, you're going to know that in your iris, particularly on the left, this is my left, there is a marker in the heart reflex zone. And if you have a marker there, that means in your DNA, there are some problems or some challenges in your heart, in your cardiovascular system. Well, in my eye, I have a huge sign. They call it a crypt. That's not a nice sounding sign, but it's kind of a dangerous sign. And there's nobody in my family that I know of that has any cardiovascular disease. However, that marker in my eye says that I am predisposed to have some heart issues. And so every 10 years, I take that formula that totally rebuilds your heart in a year. Now, again, I don't know anybody in my family, but your eye will predict, well, not really predict, but it shows your DNA from your parents, your grandparents, and your great grandparents on both sides. So if there's a marker in your eye, your iridologist tells you there's a marker in your eye, you can be sure that there's a marker in your eye. That doesn't mean you have to have whatever that marker suggests, but it does mean you need to be really proactive and nurture that point. So, as I said, I have a huge crypt in the heart reflex zone in my eye. And so, because of that, I always look after my heart. And every 10 years, I take this formula for a year. So, what is congestive heart failure? It says that congestive heart failure does not mean that your heart stops beating. Rather, it is a chronic condition that occurs when the heart muscle cannot pump enough blood into the body, causing the surrounding tissues to become damaged because of a lack of oxygen and nutrients that are carried by the blood. It doesn't develop overnight. This is a condition that is a chronic condition. That means it's been going on for a long time. And there are underlying health conditions that weaken the heart, such as heart disease, obesity, and high blood pressure. But the good news is that you can avoid a diagnosis of congestive heart failure by making heart healthy choices, including losing weight, exercising regularly, and incorporating more organic fruits and vegetables into your diet. Now, I went to a seminar in mid-October, and the dietitian was talking about how to be healthy. And she said we need to have 30 different fruits and vegetables in our diet per week. Well, I kind of get into a rut and I kind of recycle the same 5 vegetables throughout the week and the same 5 fruits throughout the week. I kind of just get into a little rut. But whenever you know better, you can do better. And so when we've been going to the grocery store, we've been doing various different fruits and vegetables to get more of the color spectrum and more variety, because there are different antioxidants that we need to help with our heart. Now, antioxidants take care of the free radicals. The free radicals are what causes us to age, what causes us to rust out. And if you remember, we brought this little scanner into the clinic. You put your hand right here, and you wrap your hand around, and what it does is it measures how much antioxidant level you have in your body. So it measures the absorption of the carotenoids into your tissue. So what that means is, how many fruits and vegetables am I eating? Am I eating just the white stuff, the rice, the potatoes, the pasta, all that kind of stuff, which of course pasta does not count as a fruit or a vegetable. Neither does rice. Those both are grains, but people are a little confused on what their nutrients are. But this scan will tell you, and it's only a $20 test. You don't need to have a big appointment with me. You can just call the clinic, say, I want to have that test. And you come in, it's a 30-second test. They mail you the report and all that kind of stuff. So if you are concerned about your heart, you want to have better understanding of your antioxidants, you need to eat more fruits and vegetables. So in addition to that, you can supplement with these 7 things. Now, the first thing on the list is CoQ10. Now, you may have heard of CoQ10. You will see it in your grocery stores. You will see it in your pharmacy. But I'm telling you, if it is not a liquid, if it is in a capsule form or a tablet form, forget about it. You're wasting your money, okay? What we want to do is we want to do liquid CoQ10. Now, we have one here in the clinic. It's a liposomal variety. What does that mean? That means you put it under your tongue and it goes right into your mucous membranes, right into the blood cells. And so it gets the nutrient to your heart where it needs. It does not go through digestion, does not go through the first pass of the liver. And so you're going to get the 100% benefit of that. So reading from this report, researchers combed PubMed and other top medical databases for controlled trials of CoQ10, with 14 trials with over 2,000 heart failure patients. The endpoints of the trials were death, left heart ejection fraction, which is a measure of the left ventricle's ability to pump blood, exercise capacity, and a standardized measure of overall heart function after treatment. The final analysis showed that patients with heart failure who were supplementing with CoQ10 had a lower death rate and a higher exercise capacity than the placebo-treated patients. Other studies support CoQ10's ability to help patients with heart failure decrease serious complications and avoid hospitalization. Now, don't we just want to do that for sure? Significant findings that were attributed to the CoQ10's ability to support the mitochondrial function and provide cellular energy to the heart. And that's what we want to do. I will tell you, we have a protocol here at the clinic that if you have receding gums, and a lot of people do, especially as we get older. In fact, there is an idiom saying that you're a little bit long in the tooth, which means that you're older. Why is that? Because we deplete our CoQ10, and one of the side effects of that is that we lose our gums. And so we have found that if you put CoQ10 in your water pick, or you just put it in your mouth and you put it along your gum line, we've seen in as little as 2 to 3 weeks that gum just starts to plump back up, and you can avoid some gingivitis and periodontal disease. So I just kind of threw that in there because we've seen that here in the clinic. Studies have shown that ubiquinol is the second supplement. Now there's ubiquinone and ubiquinol. Okay, ubiquinone translates into ubiquinol with some kind of manipulation here, but they've been studying this nutrient for about 12 years. It is considered the most active form of CoQ10. It is an antioxidant that plays a key role in creating cellular energy. So the kind that we have, the liposomal one, is the ubiquinol version. All right. So the process of ubiquinol that we make in our body begins to slow down after the age of 40, as does the ability to convert ubiquinone into ubiquinol, which is the form that is absorbed. Studies have shown that ubiquinol is up to 70% more bioavailable than conventional CoQ10. For that reason, older adults choose supplements with ubiquinol to enhance energy available in the cells. And again, if you're not doing a liquid version, then you're not going to be getting what you need to be doing. All right. So when they tested ubiquinone at doses of 900 millimeters per day, that's almost a gram, they failed to achieve adequate blood plasma levels of CoQ10. But when they switched to ubiquinol, between 450 and 900 milligrams per day, plasma CoQ10 levels increased significantly, and clinical improvement was noted as remarkable. So in medical terms, when something is remarkable, that's a thumbs up. That's not just a little bit of improvement. That is a huge improvement, and that's what we want. So you want to know that you want to get the right kind of CoQ10. You want to get it liquid. You want to get it in a liposome. If it's in a liposome, like what we have here, like I said, it goes right into the mucous membrane, sucks it right up into the bloodstream. You get 100% benefit of that. It dramatically improved the absorption, and it helped with heart failure. They saw both clinical improvement and better left ventricular function of the heart. In 2019, a study supported these findings on 400 milligrams of ubiquinol per day for 3 months. Patients with heart failure and reduced ejection fraction had significant improvement in peripheral endothelial function when compared with placebo treated patients. So this is good. The third nutrient we want to talk about is your omega-3s and omega-6s. Now, a lot of you are going to be getting a lot of omega-6s because you eat a lot of processed food. We do not want that, right? We want the omega-3s that come from your good fish, salmon in particular, your oily fish. So we know that omegas help with inflammatory processes. What is an inflammatory process? It is a process that the body is alerting the immune system. We've got a problem here. We need to have whatever we need to have. And so the body's working really, really hard. We talked about this last week. One of the signs that you have an inflammatory process is your cholesterol, your quote unquote bad cholesterol, your LDH is going to be elevated. And also your CRP, your C-reactive protein is going to be elevated as well. You could have a high histamine level as well. And so we don't want that. The article says that most people consume an overabundance of omega-6 from processed foods. A study published in the journal Lipids and Health and Disease found that low levels of, I'm going to mess this up, hopefully not. The acronym is DGLA, but the words are dihomo gamma lipoleninic acid. Sorry about that. An omega-6 PUFA, so that's polyunsaturated fat. All right. Circulating in the blood was associated with higher death rate. Okay. Low levels of omegas are associated with higher death rate. So if you have a heart issue and you want to preserve your heart function, what you need to do is to be including and improving your omega-3s. And that is what you're going to find in your fresh fish. There was a SPICE, SPICE trial. The researchers performed large-scale morbidity studies encompassing 1,442 patients with congestive heart failure, supplementing with, I skipped down to Hawthorne. Hawthorne's our fourth one. So supplementing with Hawthorne, they found that the cardiac death was reduced by almost 40% after 24 months of treatment. Now, Hawthorne is a plant. I think it's part of the rose family. And our formula that we use to rebuild the heart has Hawthorne in it. And so that's what we want to do. We want to make sure that we get that nutrient into the body. We get that in there because it reduces mortality by almost 40%. That's a huge percent. Now you have to take it. They tested it for over 24 months. So it's not something you take today and it helps your heart tomorrow. It is something that builds up. It creates new parts in your heart some research that I read called this formula a heart transplant in a bottle. So if you've got this, you really want to check this out because they have found that it reduces mortality, death by almost 40%. All right. So the fifth one, I think we're on number 5, is berberine. Berberine, they call it a plant-based medicine. Now, we use berberine a lot for inflammatory conditions. One of the inflammatory conditions we use it for is inflammatory bowel disease because we find that it really just calms down that inflammation, but it also works with congestive heart failure. In 2010, a berberine derivative that was found to strengthen the heart by blocking calcium influx, a central cause of the failing heart, and exerting powerful antioxidant activity. Among berberine's heart-boosting properties is anti-arrhythmic activity that has been shown to prolong the duration of the ventricular action potential. In other words, it creates a stronger, more rhythmic heartbeat. So this is something, if you have AFib, which is an irregular heartbeat, berberine would be a really good herb for you because it stabilizes your heart rhythm. And that's what AFib is. And so berberine has been found to be very, very helpful in cardiac issues. And we want to use that if we have congestive heart failure. We want to make sure that we help with that. It's the next one, number 6, is a magnesium. Now, magnesium is a mineral salt. It's critical for more than 300 different enzyme functions in the body. So most people are deficient in magnesium, and magnesium is the mineral that's really, really good for the heart, really beneficial for the heart. So if you crave chocolate, then you are low in magnesium. If you get cramps, you're more than likely low in magnesium. It could be potassium, but we have found that magnesium, supplementing with magnesium, is really, really good for cramping. And so that's something that you might want to look at if you have congestive heart failure. Enzyme activity. So every chemical reaction in the body takes place with enzyme activity. Enzyme activity, you might think about digestive enzymes. It helps you absorb your food. It helps you break down your food. And yes, you're right. But there are proteolytic enzymes, which you take away from food, and it helps all your little chemical processes to work better. And so this is something that you need to do. Magnesium is one of the drivers for those chemical processes in the body. And so if you are low on magnesium, you're going to have very ineffective enzyme action. So we want to make sure that we help you with that. Magnesium also regulates blood pressure. No one's told you that in a while, right? Magnesium helps regulate blood pressure. Research has explored the use of magnesium in patients with heart disease. Some of the studies focusing on the role magnesium plays on the endothelial dysfunction, which is a hallmark of heart failure. This is what happens when the blood vessels of the heart constrict instead of opening or dilating. So we want those blood vessels to be open. We want them to be flexible. We don't want them to be hard and crunched. We don't want that because when that happens, then you've got high blood pressure. You've got other issues as well. Hardening of the arteries. I'm sure you've heard of that. One study published in the Journal of Congestive Heart Failure, that's a journal name, found that oral supplementation with 800 milligrams per day of magnesium oxide for 3 months produced improved arterial function when compared with placebos in heart failure patients. The importance of lost minerals to heart health has been clearly ascertained, with low magnesium levels contributing to oxidative stress, compromise antioxidant levels, and tissue damage to the heart. Now, I just want to tell you, magnesium oxide is not my favorite. Why is that? Because if you have too much magnesium oxide, it's going to have you go to the bathroom and it can cause diarrhea. Okay, so there are other forms of magnesium that are much more beneficial to the heart. And we have like a plethora of different magnesium products because depending on what you need in your body, there are different forms of magnesium that are going to be very bioavailable, and that's what we want. We do have products that if you have constipation and you need magnesium to deal with that, we got you on that, okay? But If you're worried about your heart, if you're worried about cramps, all that kind of stuff, we've got other different magnesiums that are going to increase your level of magnesium, but not cause you to run to the potty. Okay. So we just kind of have whatever you need for whatever source of magnesium that you need. The seventh supplement is called L-arginine. Now, L-arginine is an amino acid. Amino acids are the proteins that you get from the food that you're eating. All of your DNA is built out of amino acids. So if you are low in your amino acids, you're going to have problems in your nutrient delivery system because you're not going to make those proteins. Remember, the enzyme action breaks down your food, breaks down the nutrients, break down your amino acids so that you're able to have those building blocks that you need for repair and rejuvenation. So L-arginine is important for numerous bodily functions, including dilating and relaxing arteries. Now, a lot of our bodybuilders will use L-arginine for recovery after workout because it relaxes the blood vessels and it causes more blood flow to be able to go where it needs to be. If you are a gentleman of a certain age and you're having erectile dysfunction, L-arginine could be your best friend because what it does is it gets more oxygen, more blood flow. You get more blood where you need it, and you're not going to have that dysfunction that nobody wants to talk about because that L-arginine is nitrous oxide. And just like what nitric oxide does for your automobile, if you're a racing fan, it does that for your cardiovascular system, and it gets the blood where it needs to be. And so everybody can be happy. So that's just another little tidbit that I'm just throwing out there. Foods such as pasteurized red meat, I just said pastured red meat, fish, poultry, and dairy products are your primary source. Vegetarians can look to whole grains, nuts, and seeds to boost their arginine intake. Arginine's role in healthy heart function has been the focus of numerous studies in the recent decades. Supplementation for 6 weeks, now 6 weeks is not a long time. Supplementation for 6 weeks has found to enhance exercise tolerance in heart failure patients, an important marker of heart stability. Adding arginine to a regimen of CoQ10 and vitamin D was found to be beneficial in both cardiac and endothelial cells that line the blood vessels due to their cooperative effect. So I don't know why your medical doctors don't want to test your vitamin D level, because for me, vitamin D is one of the essential nutrients you need for many, many, many things to happen. I have been taught in my studies that if you have a high enough vitamin D level, you can't get the flu, you can't get depression, you can't be depressed, and it's much harder for you to have cancer. So for those 3 reasons, we want our vitamin D level to be above 80 nanograms per deciliter. Your medical reference range will tell you if you're just 30 that you're doing just fine. We don't agree on that. All right. You can look at the literature yourself and you can decide who you want to believe, but we want to make sure that our vitamin D level is above 80. So that's what we want. Vitamin D is going to help your CoQ10 work better. It's also going to help your omegas work better, and it's going to help your heart work better. So in a meta-analysis of more than 30 years worth of scientific studies on L-arginine, it found that oral supplementation exerts favorable effects on the prevention and treatment of a variety of cardiovascular disorders, including mild to moderate heart failure. Now, of course, before starting anything, you want to talk to your doctor and make sure that your doctor is aware of what you're trying to do. Doctors that are keeping abreast of functional medicine. Now, functional medicine is a combination of synthetic drug prescriptions, natural, holistic diet, lifestyle changes. So functional medicine doctors, they kind of marry the two. And so that's what you want to look for if you are taking medication, because we want you to not have to rely on medication all your life. If you do need medication, we're all for that. But with nutrition, proper nutrition, you can usually restart and regenerate those parts of the body that are not working properly. And when you do that, your need for medication is going to decrease. And so when we have people that come in, they are on heart medication or they're on blood sugar medication. And these are medications that you have to be on every day. And we start working with them on diet and lifestyle changes. We ask them to keep a journal, and we want them to journal their blood pressure and their sugar twice a day. We want them to do it in the morning. We want them to do it in the evening. As those numbers come down and they get close to normal range, when they're in there still taking their medication like they're supposed to, then we ask them to call their doctor and say, Doc, my blood pressure used to be here, but now it's here. I think we need to adjust the medication. And almost 100%, the doctor wants you to come in, wants to do his own test, wants to make sure that you're telling the truth. And then when they see that you're responding, they go, oh, great. You don't need that medication anymore. And they will reduce or even discontinue, which is, of course, what we want, because almost all medications are made out of petroleum products, and nobody has ever benefited from eating petroleum. Just gonna throw that out there. Okay. It is the weekend. I love you guys. I want you to have a great weekend. Get some rest. Next weekend is Thanksgiving weekend. We won't be here. I'll be celebrating with my family. So don't expect to see me next week. I won't be here, but I'm going to love you. I'm going to wish you happy Thanksgiving right now, and want you just to enjoy the week. Be good to yourself. Do a lot of self-care. Be very, very grateful. Be thankful for the things that you can. And I will see you in 2 weeks' time. Take care.